Bismillahirrahmanirrahim. May I introduce myself. My name is Abdelrahman Al-Rifai. I am a pediatric specialist in Tahrir Public Hospital and also pediatric consultant in Egyptian Medical Syndicate with special interest in care of children with special needs. Today, we will talk about nutritional assessment and anthropometric measures. This presentation is produced in participation with my colleagues, Dr. Ahmed Taha, Dr. Ahmed Farh, Dr. Ibrahim Saad, Dr. Mahmoud Taha, and Dr. Huda Uday. Okay, at first, what is a nutritional assessment? Nutritional assessment is the evaluation of the nutritional needs of individuals based upon appropriate biochemical, anthropometric, physical, and dietary data to determine nutrient needs and recommended appropriate nutritional intake, including enteral and parenteral nutrition. Okay, major goals in the assessment of nutritional status include the most three important items is identification of malnutrition and its effect on the individual's health system. Identification of pattern of overconsumption and identification of nutritional parameters for optimal health and fitness. There is a AAA cycle derived from UNICEF website composed from these three items. It begins with assessment and to the analysis and to the action. And this process is continuous process. Nutritional status assessment measure anthropometric measures and biochemical and physiological characteristics, and these assessments combined with the analysis of underlying causes will result in appropriate action. Okay. This is a rough tool maybe used by some pediatricians or some internists called or named malnutrition screening tools. First of all, you have to ask your patient, have you lost weight recently without trying? If no, you give him 0 score. If unsure, you give him 2. If yes, how much weight? And upon these measures, you have to give him a score. If the score is 2 or more, please refer to a dietitian. And this is also called subjective global assessment form, maybe used by nutritionists or dietitians, or by you if you want, but I'm not sure if there's Arabic translations for this subjective global assessment tools. Okay, dietary assessment, nutritional intake of human is assessed by 5 different methods. They are 24 hours dietary call, food frequency questionnaire, dietary history since early life, food diary techniques observed for consumption, and we will talk about each item in some detail. 24 hours dietary call, a trained interviewer asks the subjects to recall all the food and drinks he consumed during the 24 hours previous to the visit. Okay, it is quick, easy, and it depends on short-term memory, so it's not difficult at all, but may not truly representative of the person's usual intake. Food frequency questionnaire, you specify 100 items of food items and ask your patient about the frequency of intake of these items. Okay, it is inexpensive and more representative and easy also to use. There is a limitation for food frequency questionnaire. This is a long questionnaire, errors with estimation of serving size, and it needs updates with the new commercial food products in the community. Okay. What about dietary history? It is accurate method for assessing the nutritional status. The information should be collected by a trained interviewer. Details about usual intake, types, amount, frequency, timing, and need to be obtained. Cross-checking to verify data is also important. For diary, food intake, types, amount should be recorded by the subject at the time of consumption. Means everyone should record in his diary what he ate and which hour. Okay, the length of the collection period range between 1 to 7 days. Observed consumption, it is maybe for research mostly, but you can use it in special considerations. Nutritional assessment, in addition to previous specific tools, the following information is useful to determine nutritional patterns and states. Key history points. General background information, you have to take it. Name, age, sex, family composition, socioeconomic is very important for nutritional impact, and also occupation. General health status and any chronic conditions, including diabetes. Cultural and religious factor influencing dietary patterns. Family history of diseases, including diabetes and obesity. counter medication, over-the-counter products, and herbal supplements. And also you have to ask about food habits, typical daily intake, including meal frequency, meal timing, and meal location. Snacks pattern, food intolerance or dislikes, nutritional supplements, including vitamins, minerals, fortified beverages, and foods, okay, and also alcohol consumption, use of specific diets or dietary restrictions. You have also to ask about food percussion and the preparation. Who gets this? Who percuss and prepare foods and where food is percussion, okay? Facilities for food storage and preparation, and factors influencing the types of food percussion. Nutritionally related problems, general well-being, energy level, weight change during the past 6 months, difficulty chewing or swallowing, use of dentures, change in sense of taste or smell, eructation, flatulence, nausea, vomiting, diarrhea, all these symptoms you have to ask your patient about. This is extremely beneficial for your assessment. Okay. We have to come to the physical examination and anthropometric measures. First of all, perform systemic physical examination, observe for any abnormality. You have to notice one of these symptoms: listlessness, apathy, foot muscle tone, dull, brittle hair, hair may be thin or sparse, rough, dry, scaly skin, dermatitis, cheilosis, and etc. Each one of these items will indicate a specific deficiency in micronutrients. Okay? Protein and zinc and biotin deficiency may produce sparse and thin hair, and protein deficiency may produce easy to pull hair. Vitamin C and vitamin E deficiency, corpuscle and coiled hair. Riboflavin, niacin, folic acid, glossitis. Vitamin C, A, K, folic acid, niacin, bleeding, spongy gums. Vitamin B2 and 6 niacin may produce angular stomatitis, cheilosis, and fissure tongue. Okay? And also vitamin A, vitamin B12, B-complex, folic acid, niacin may produce leukoplakia, and vitamin B12, 6 niacin, folic acid, iron may produce sore throat and tongue. Okay, vitamin A deficiency, it is the most popular deficiency in vitamins. It may reduce night blindness and exophthalmia. Okay, and vitamin B2, vitamin BA deficiency together may produce photophobia during conjunctiva inflammations. Iron deficiency, as you know, may produce spooning, and protein deficiency may produce transverse lines in the nails. As regards skin, you may notice pallor. It indicates folic acid or iron B12 deficiency. Follicular keratosis, okay, may indicate vitamin B and vitamin C deficiency. Okay, pigmentation score measure may indicate niacin and protein energy malnutrition. Bruising and burgra, vitamin K, vitamin C, and folic acid. This is goiter, and you have to notice if it is present. It is a sign of iodine deficiency, maybe. Maybe you have to ask for or request for X-ray to help to detect signs of vitamin D deficiency or vitamin C deficiency, which produces scurvy. Sometimes, in some cases of stunted growth, you may ask for X-ray of the left hand to indicate or to tell you about the bone age. As regards anthropometric measures, anthropometry comes from the word anthropology, and this is science that studies the size, weight, and proportions of the human body to determine food fat mass, lean mass, and nutritional status. Types of anthropometric measures include height, weight, skin fold thickness, and circumferential tests to assess nutritional status. We will come late to discuss anthropometric measures in details, but now we have to tell you about diagnostic tests, initial laboratory assessment, urine and stool analysis. It is the first step in your assessment as regards the diagnostic tests. Okay, maybe some serum albumin. It is popular in the field of nutrition assessment, but in a limited value. Limitation or assessment, it is most beneficial in hospitalized patients and influenced by albumin synthesis, degradation, and distribution. Low albumin levels have been identified as a predictor of mortality in patients in long-term care facilities. Okay. Second item is hemoglobin and related indices. It's also important to determine the health status of the patient. Serum transferrin, which is the first indicator to be elevated in iron deficiency anemia, and the last to be regained to normal in iron deficiency anemia. You may be interested in 24-hour urine creatinine. Also, we have 24-hour urea nitrogen or total urinary nitrogen. It's also beneficial in some situations. Retinol binding protein. I don't know if it is available in Egypt or not, but it is maybe for research issues. Insulin growth factor 1. It's also considered in some specific cases in nutritional assessment. Advantages of biochemical method: it is useful in detecting early changes in body metabolism and nutrition before the appearance of other clinical signs. It is precise, accurate, and reproducible. Useful in validating data obtained from dietary methods, comparing salt intake, such as comparing salt intake with the 24-hour urinary excretion. Okay. Limitation of biochemical methods: time-consuming, expensive. They cannot be applied in larger scale and need trained personnel and facilities. We came to the anthropometric measures, which is the cornerstone of our presentation today. Anthropometry is the measurement of body height, weight proportion. It is an essential component of clinical examination in infants, children, and pregnant women. It is used to evaluate both under and over nutrition. The measured values reflect the current nutritional status and don't differentiate between acute and chronic changes. You have to put this in your mind. It reflects the current nutritional status and don't differentiate between acute and chronic changes. This is your responsibility as a clinician. Okay. Anthropometry involves the measurement of physical proportions of human body. Okay, we discussed this point. Different growth parameters are measured and obtained values are plotted on growth curves, which are expressed in percentile values. Values below the 3rd percentile or above 97th percentile are pathologically abnormal. Growth charts below show scale measurements over time. These growth charts may be derived from a WHO website and CDC, and we have Egyptian growth charts developed in what? No. Egyptian growth curves produced in 2002 by Cairo University, okay, and it is also important to have in your clinic and in your work to measure the growth situations. Okay, stitcher for age: remove the child shoes, bulky clothing, hair covering, and also to maintain the upright standing occupation of the scale. Okay. In this position exactly, these 4 points must be in contact with the flat border or flat wall. Okay. These are the charts for stitcher for age percentile for age between 2 and 21 for girls and boys, and this is the procedure of how to measure the length in recumbent children or recumbent situations. The child should be placed supine on a measuring board, and the measurement should be reported to the nearest 0.1 centimeter. And this is the chart: recumbent length for age percentile, Egyptian girls, birth to 36 months, and boys to 36 months. Growth velocity is an important item to discuss today. Height velocity measures are the most sensitive in detecting growth abnormalities.
What is the T?
Okay, even in all types of chronic illness, any child more than 2 years which had a height velocity less than 4 centimeters per year, you have to go in depth to assess. Okay, and during puberty, peak height velocity is between 6 to 12 centimeters per year in boys and 5 to 10 centimeters in years in girls. Below this, you have to go through assessment. Okay, how to measure weight without any clothes, preferred without any diapers, to attain a perfect weight measurement. Okay, this is weight for age. Weight for age percentile for girls between age from 1 to 36 months and girls between 2 and 21 years. This is for boys. Measures of adiposity. For children aged between 0 to 2 years, the weight for length is used instead of BMI. So important in this category of children. For children aged 3 to 5 years, BMI for age and weight for height predict adiposity equally. Okay. After that, we may use BMI. Okay, so these are the charts for weight for recumbent length. Okay, body mass index charts. Head circumference, it is important to measure. It is always forgotten in our clinics to measure. But okay, microcephaly it is below two standard deviation below the mean. Macrocephaly it is above 2 standard deviation above the mean. This is microcephaly. Microcephaly, it is a normal measurement. Okay, this is the curves of WHO. Okay, we may stop this. And came lastly to special growth charts. There are special groups of children may have or may require specific growth charts for them. These are the most familiar or most common types or most groups of children: preterm babies, Down syndrome, cerebral palsy, Turner syndrome, Williams syndrome, achondroplasia, Prader-Willi, Cornelia-de Lange, and Marfan syndrome. Okay. First of all, we have 3 most common groups I ever seen: cerebral palsy, preterm baby, and Down syndrome. You have to know about them. Okay, this charts derived from this research published in 2011. Okay, under the name of low weight morbidity and mortality in children with cerebral palsy. Okay. And here he divided the group of cerebral palsy into 5 groups according to gross motor function classification system. 5 groups. First one walks without limitation. Second one walks with limitation. After that, walks using handheld mobility device. Self-mobility with limitations. Okay. Thank you. Any questions? Thank you. Any questions for me, doctor?
طبعا.
Yes.
ايه في الزعل التسجيل بتاعك؟
Okay.